Okay. Oops. Hate this thing. All right. Testing, testing.
Yeah, I can hear you fine.
Yay.
I should have that other stuff for the board orientation pretty early.
Okay.
Yeah, I'm most of the way through that.
That's fine. I have a feeling Dr. Halverson is, well, he's definitely going to be late. So we'll just have Mr. Power start the meeting.
Oh, you mean tonight, huh? Okay.
Yeah, because he said he was driving back. So I think he's going to join us from the car. Dr. Halverson, anyways.
All right.
And Doc's just getting back. So she'll join us shortly when gets settled.
Okay.
What's this? Okay. Okay. Coffee time, Jim.
No, I'm fine. So Dr. Martell called me and let me know that she was kind of looking for some assistance when you're gone. So I'm not really able to. If there's some stopgap things that we can do, we're happy to do that.
Okay.
We'll just have to, we'll just have to.
Wing it.
Yeah, we'll wing it. We'll get, you'll let me know you won't leave town, right?
I won't. Hi, Angie.
Hello there. I hear we're being recorded already.
Yes, we are, ma'am.
Okay. How many more do we have to go?
We're waiting for Dr. Halverson and Jim Powers and Dr. Helland. And I know that Dr. Halverson's going to be a few minutes late. Doesn't start till 5:30, so you're always early, Angie.
Honey, the reason I tried to be is because sometimes it takes me a half hour to get on.
You do
Then I have
great.
to go downtown and do all these other things.
Yep.
So it's not because I plan it that way. It's because half the time I can't get on or something goes through.
You're
But then
great.
that's me.
You're fine.
I have that problem in all my meetings.
It's better to be early.
Yeah. And I even fed the dog so he won't bother me. If you hear this woof woof, it's him.
What's his name?
His name is Cash, and he's a little Shih Tzu. And he's not my dog. He belongs to my granddaughter. But since she has children, I get to babysit her dog. And I just as soon babysit a dog at my age than a kid where I have to change diapers and everything else.
I agree with you on that one.
Yeah, I looked on it. She spends all the money on him, gets him
Oh,
groomed and the vet and everything. All I have to do is enjoy him.
yeah. At least you don't have them asking you every 5 minutes, what's this? What's this? What's this? I love
My
having those conversations with my grandchildren, but sometimes it's like, oh my gosh.
my daughter's going through that with her grandchild, my great granddaughter.
Oh my
It's
goodness.
too bad because of the fact when her son was small, they both had to work, but I got the glory of raising the first
Mhm.
one until he went to school. So now she's getting a taste of what I went through, and I did because I took him from a baby, and
Mhm.
I was working at the same time, but not my hours were real flexible. I could make my own hours. I was self-employed, so she's having fun. She's retired now,
Oh
and she's
yeah.
still enjoying her great granddaughter. I mean, her granddaughter. And that
Mhm.
kid talks constantly, and she's only two, a little over, no, she's not even 2.5 yet. And the vocabulary, because all she is with adults, she's not with other children, which is sad. They need to be with other children too.
They
But,
do. Yeah.
mm-hmm, they
I
truly
noticed
do.
the difference. Yeah, because my oldest kind of grew up by herself for a little while until her brothers came along, and the youngest one, oh, he just hangs on to his brother and sister like crazy.
Yep, yep. I've been there, done that.
Yep, me too.
But it's fun. I wouldn't trade any of them.
But I'm glad it's over.
Yeah, because now I can sit back and enjoy them,
Yep.
and uh, and that's the fun of it. I raised my kids, and
Mm-hmm.
uh, I had fun raising them, and I got to with Joshua the same thing. And then there was 10 years between Joshua and her next child,
Wow.
and yeah, and by that time I was working full time, so I didn't have time, and my girlfriend took care of her. So it's just I don't know, it's a whole new life.
It is.
But if you have to work, you have to work in order to make a living and have a home for your children.
And these days, you definitely need that.
Yeah, we seem to get along with. My husband worked two jobs, so that I didn't go to work and stayed home with my children until they were all in school.
Your husband was a very nice man.
Yeah,
I
and that's.
remember him very well.
Do you really?
Yeah, I was happy to be working with him when he was an alderman.
And were you at the health department or someplace else?
No, I was at the mayor's office.
Ah, okay.
Yeah. So I think that was Doug's term. Yeah.
Well, yeah, it was for Doug.
Yep.
Yeah, that's when he.
Long, long time ago.
16 years now.
Oh my God.
Doesn't seem like it, does it?
No, it sure doesn't. It sure
And
doesn't.
came the next mayor and he screwed everything up. But don't laugh. Our last. Oh, we're
We're
on live.
live, Angie.
Forget it.
Thank you. No.
Can you start off?
You've been in politics for a long time. I know.
Not really. Not until Dick got involved.
Hmm.
And um,
Angie,
I
that
was
was
doing.
16 years ago.
Yeah, I know. It was like yesterday. Truly.
Yeah.
Uh-oh, you just got company.
No, it's just notifications and just really loud.
Christina, I didn't with the city.
Yeah.
What did you do with him?
I was Einer's assistant.
He's one man I truly like.
Yeah, I do too. He was my mentor.
Yep.
Yep. Learned a lot from the man.
That Mr. Powers there?
Sure is. Be safe driving, Lisa. Hi, Jim. We are live.
Hi, Christina. How are you?
Good. And Dr. Halverson is going to be running behind a little bit. So maybe when Dr. Helen joins us, if you would be willing to start the meeting, that would be great.
Surely.
We'll just wait for Dr. Helen.
I assume in starting the meeting, the first part of it is Dr. Martell's part of it.
More than
So-
likely, you'll just have to set the agenda and then Jim can take over.
Okay. So it's Dr. Martell isn't going to be with us?
Yeah, she will. She's a little tied up, but she'll join us shortly.
Okay. So Jim will become Dr. Martell for a period of time.
Sure.
Sure. I can try.
Okay. Just want
Hey,
to
Ray.
get things straight.
Just don't ask me any questions on biology or chemistry or immunology. I can go on and on about all the things I don't know. So,
Okay. Well, those were I had some of my questions. So I
Oh.
don't know what we're going to do.
okay.
Hi, Angie.
Hello there. How are you doing?
Doing well. How is summer going for you?
Pretty good. It's pretty good.
Good.
I've been in a whole lot. I'd like to be able to get out and do more. But it's just, I don't know. Don't have the energy to go out in that heat right now, that humidity.
Oh, yeah. The humidity is really. And it's going to get a little bit warmer and more humid too.
Yes. But that's summer. That's what we like about summer, isn't it? That's why I live where I live.
Right.
I don't have
the Northwest.
Yes, but I don't have forest fires. I don't have hurricanes and tornadoes so much, and I don't have to put up with a lot of flooding. And so I'll take the humidity for a little bit.
I will take the humidity for a little bit too.
Yep. And some nice snow in the winter.
I could pass on the snow.
Oh,
Oh, as long as we have some snow, and I don't like the ice. I can take the snow.
is that you, Dr. Halverson?
That is I.
Awesome.
We don't see a pictorial of you today. We're seeing a phone. Any particular reason?
No. Yes, I am driving right now. I got caught up in some traffic, and I hope to be home in about 15 minutes or so, 20 minutes, but it's hard to say. It seems to me I've been moving in and out of some dead spots too, but hopefully we'll be able to maintain this. I probably won't be able to chair the meeting because I should not be reading as I drive, but we can get this going whenever, because I have no idea who is on or not.
We have a
Do we have a
quorum.
quorum? Let us start then.
Yep.
Or Jim, why don't I turn this over to you to get this underway, if you don't mind?
Okay,
Since you can see.
I will do that.
Thank you.
Would like to call the meeting of the Finance Committee on June 30th of 2021 at 5:35 and ask for approval of the agenda. Do I have a motion?
I move that.
Second.
Do I have a second?
Second.
Okay. I have a motion and a second to approve the agenda. All those in favor say aye.
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 Aye. Okay, the agenda is approved. Since Dr. Martell is not with us just yet, Jim will pick up the other Jim 2. I'm taking the
Okay.
prerogative of identifying Jim 1 and Jim
All right.
2. Jim 2 will take up and begin to give us an overview of the health department budget. We should have gotten at least the written form of that, but we need your oral explanation.
Okay. Happy to oblige. Christina, can I share my screen?
Yes, please.
Okay. All right. Okay. Okay. For those of you that, aren't driving, can you see my screen?
Yeah.
All right. Okay. I guess we'll start with, this is obviously the agenda, but we'll go to, the second page, which is the schedule of our anticipated revenues. And I think what we like to do is kind of compare where we are and how we're going to change in 2022 as opposed to 2021. And these are the schedule of the various revenues that we have: grants, fees, private reimbursements, and then the levy. So last year we had a budget here on the bottom of 14,383,000. And this year, preliminary, we're starting with 10,817,000 roughly. So I'll kind of go over some of the highlights. We're anticipating the levy is going to be flat. And then this local health protection grants will be about the same. The vital records, which is the birth and death certificates, should be slightly uptick based on, our run rate as of the first 2/3 of 2021. And then some of these grants that have been come in and processed, which we're getting final sign off on, is the bioterrorism, which is the public health emergency protection. That's going up slightly. Our HealthWorks grant for 230,000. We're anticipating that's going to be flat and the same this year through Centene, which is a DHS is kind of, or DCFS, I believe, has farmed that out, and so we're contracting with them.
Jim,
Yes.
In terms of the HealthWorks one, it says it's going from 54,000 to 230,000.
Yeah, that was the final amount through Illinois, actually, DCFS, and then we switched to Centene. So now on an annual basis, we should be running at 230,000. So
okay, thank you.
Yeah. All right. And then these various Department of Health, Human Services grants are all relatively the same. The maternal and infant early childhood home visiting program went up slightly, but that's because they're rearranging how we paid for our consulting. So there really isn't any uptick for the health department on this one. The teen pregnancy prevention program didn't go well, and that's been suspended through the state, not through any fault of ours, but that program they notified us in early June that it wasn't going to be renewed. We have a slight increase in our special nutrition program for WIC. We have a breastfeeding care counseling that's the same. Most of these others is the same. Then naloxone is a large, sizable grant from state opioid response. There is an uptick here in the breast and cervical screening program as they're expanding that program with I think a few more cases, more patients. I don't know if they're the rationale behind that, but that's we have just kind of finalized the arithmetic on that. And then the dental sealant program has kind of changed in its um, in its delivery and is not quite the same program that we had before. The family planning is an interesting one. I'm not sure. Right now, we're expecting it to be flat, but I don't know if there'll be an increase with the change in administration and the change in philosophy that maybe the state will go back to the Fed. Um, um, the Fed, they can deal with the federal administration now. Now these environmental health programs, which is the food service permits, the well and septic, and those things we're kind of predicting a slight downturn on that because of some closures that we've had. As we talked about at other meetings, waiving the permit fees for 2021, but this is 2022. This childhood lead poisoning prevention is going to be the same, and essentially most of the rest of these are fairly the same. Down here on the bottom where we have the HUD creating lead safe, we're starting to really ramp that up and have our contractors trained and certified and utilize the healthy homes portion of that of the HUD grant. So that's a 3.5-year grant total, but we're anticipating performing and utilizing 975,000 in 2021, and then about 1,020,000 in 2022. Now this population vaccination program, it's the total award is 725,000. 650 of it will expire and span through 2021, and the remaining will be in 2022. And then we have an Illinois Wise Woman program, which is kind of it's a subset of the breast and cervical cancer. It's additional care and counseling for those patients. That has been renewed. I wasn't sure at the press time, but that's going to remain at 62,765, and I have 0 in there now, but that will change. That program's active. They just have been late with their some of their paperwork to us. So the contact tracing program, we're expecting it to continue on through the end of December. So that's going to be about a quarter year. So we anticipate using 3,250,000 in 2021 and the 420,000 in 2022. So that's pretty much the story of the revenues.
And can I ask? Oh, that's revenues. Can I ask you a question too? Are we still at the jail doing cervical and breast examinations? Or are we no longer doing that?
Angie, it's Dr. Martell. No, we are not. They have contracted with the University of Illinois for their health services.
Thank you.
Okay, and then I'll go on with the next page here, which is these are all the positions that we have, various codes, how many people are occupying the position, their wages, and then an assumed cost of living increase, which is would be at 3% in April, so 1.5% would be over the whole year, and then the right-hand column would be the total. And this is assuming that we fill all these positions, and that will enable us to fulfill all the obligations for those grants. So the total is between full-time and part-time comes out to 105.8 FTE, and then the wages would be roughly $5.8 million down here in the corner, which would be the total for all of these. So So more, as a benchmark, our budget in 2020 was 5,455,000 for 108 positions with 5 part-time. And then in 2021 for permanent positions, we had 5,663,000 in budgeted wages, which was a increase of 4%. And then in 2022, we have that same 5,796,000, which is an increase of 2.4% from the previous year. In addition to these wages, we would also incur these temporary positions for the contact tracing, which is rough. We have 29 people, which would extend on for 3 months beyond our fiscal year 2021. So Q1 in 2022, we would have these, and then at that point, the program's scheduled to expire and the grant to expire. So these temporary positions would be
Jim?
gone. Yes.
And just because I don't see it in the detail, did you include a 3% COLA for the 22 projections?
Yes, I did. That's right here in all these figures here represent.
Yeah, I can't, with the way the screen prints. Okay, there we go. So
Yeah.
just so when you're saying there's a 2.4% increase from last year on the salary,
Right.
it's based on the fact that we've done the adjustment. All right, thanks.
All right. Yep. So that's where we are position wise. Does anybody have any comments or questions now? No? Okay.
Nope.
All right.
No, it's fine.
Okay.
Expenditures.
Okay, then I'll move on to these are the expenditures, and the majority of them are the personnel at almost 7,950,000 budgeted. So, and then you'll see our regular salaries here that 5,796,000, which is from that schedule up above, and then the temporary ones at 336,000, and then the rest, are essentially estimates based on previous run rates. So, our total expenses would be 10,722,046 up here, which of that, 7,950,000 of it roughly is related to personnel and benefits. Some of the larger expenditures here are, medical and dental supplies, which is from our significant portion of that is the naloxone program. Also, we have consulting.
And those are our physicians and our nurse practitioner.
Right. Yeah, we have medical and dental consulting. This one is the like the advanced practice nurse and Dr. Schiller and UIC, the pharmacist. And then we have other professional services, which is it's actually like the contractors through HUD, and also some of the things that they do in environmental, and then some of the fees that we charge every month for electronic death certificates all pile in there. So I kind of try to sort these high to low and do audits and look through previous history just to make sure that we're on target on that. So this comes out, our total expenses here through all these is the 10,722,000. This year we don't have a $350,000 transfer to the 555 North Court Fund. So, but these are the totals. And then if we go to the summary, we have our 10,816 in revenues, and then the expenditures at 10,722. So almost $100,000 excess of revenues over expenditures. So as of right now, we're through May, we're running at almost $1,939,000 deficit. We budgeted almost a $500,000 deficit, but I'm anticipating that we'll come in at about 378,000 for 2021, and then we're budgeting a surplus of almost 95,000 for 2022. So it's preliminary, but I don't think that the revenues based on the list that I went through are going to change much. I'll have some, a couple that'll go up, a couple that'll go down. So so I think that we'll be in that ballpark. And we look forward to hopefully a healthier and more effective year. So,
Okay.
so
Are there any questions or comments for Jim in terms of the different items that he has presented? Okay.
No.
Were there any particular comments you wanted to add, Dr. Martell, in terms of the overview of the budget?
Sorry, Jim, you'll have to, I can't drive, so you'll have to.
okay. All right. Did you want me to stop sharing? Or?
No, I want to show you, continue sharing, but the new positions, I want to make sure
Okay.
that everything's clear. So we have a kind of an unusual year in that the contact tracing and the population vaccination grant are going to span part of the county fiscal year, right? So, because those will end technically December 31st. So that's where you end up with this kind of wonky number, but can you come down to the new positions, Jim? I just want to make
okay, back up here. Yeah.
the capturing the new ones that have been added.
Yeah.
Because I think that, okay.
Yeah, this would be our complete list here.
Okay, but I think the next page, don't you have a summary about new positions?
Well, yeah, it's the total count and what they've been every year. And then these below are what the contact tracers are that are temporary. So
I know, Jim, and again, I haven't gotten into the detail on all the grant budgets where it's generating from, but I know that we are currently working from a CD perspective that we are going to add an additional not a contact tracer, case investigator as part of the HIV, Jim. That was, I mean, it might be helpful to identify a summary of new positions that are going onto the budget.
Okay, yeah, I can. I don't have. Yeah, I can put that together.
Again, a lot of talking, and I think just so for clarification, like the teen pregnancy, again, that was part of the federal initiative on. And I think they're restructuring that. It's not that the program wasn't effective. I think part of the challenge was that was an in-person school program that got really impacted heavily by COVID. So they kind of are pulling those grants and kind of retooling it to look at how they do around pregnancy prevention. And remember, the state of Illinois chose not to use Title X funds from the federal government to run its family planning. So that's where Jim is talking about it may change, right? So given if there are changes to the DHS rules at the federal level, the state of Illinois may go and apply for those dollars and then distribute those federal dollars to local health departments or grantees under the Title X program.
Okay.
Right.
And the dental
Now,
sealant,
what
just
are
another,
for?
pardon?
What the two investigators? What are those now?
Well, if you look at, you're talking about there, we're adding a full-time FTE, called the disease intervention specialist or disease investigator. We are adding a third one kind of as we rolled out of the contact tracing to do more work on the HIV prevention side. So, typically when you think about HIV work in a health department, we have the surveillance, we have the when we reorganize that department, they have general CD for everything that's non-STD. Then we have STD. And under that, we have 2 STD, and then we have HIV prevention services. And so in looking at how the work effort that's required, we really felt it was time to add kind of a third leg on that stool to do the HIV prevention work. That's separate than Ryan White. That comes in as a separate grant. And this position really will be used for conducting what we call the surveillance related to HIV. They also will be doing the initial investigation of newly diagnosed cases. And every month we get reports on individuals who have fallen out of care or are not enrolled in care that are HIV positive, to re-engage them for routine primary care, connect them back up to Ryan White. So we get multiple pots of funding under HIV. We get Ryan White case management services. We get what's called HIV prevention services. And so really kind of building that as a kind of to support the STD part of it. We felt that was necessary. So Todd, we talked about that. So that's an additional position, kind of when you think about I'm going to say one of our core functions here on disease investigation and prevention. We looked at how do we restructure it. That makes sense, Andy? Part-timers here are, as our contact tracing staff are starting to, how do I say it? They've kind of recognized the handwriting on the wall that December 31st, and remember, many of these knew they were hired on for the pandemic. And what we've done is some of them have gotten other full-time jobs, they wanted to remain as part-time. And so that does not mean that they're necessarily kind of working through that, in terms of all of that, so again, there was a lot of maneuvering on that. Anything else, Jim, on that you can provide Angie context on? I know he's got those investigators. There's 4 of them. There's 1.3 part-time. There's a half-time supervisor.
Yeah, and we're assuming that they're going to fulfill their whole 12 weeks after the end of the fiscal year for Q1. So
Okay, sounds good.
yeah.
Are we hoping to get some of these new positions from our contact tracers? Because I think that was kind of the hope that we would be able to pull some of these in to do some other work within the health department. Okay.
Yes, Dr. Halverson. In fact, we've actually moved some of the staff, not when I say moved, we allow them to time code. We have to allocate their time. But for instance, we have some of them are working on the population vaccination efforts when our cases are low. So we code their time. We are, one of the supervisors is now working as kind of the staffing coordinator for the vaccination clinics. We also, during this last response to the chem tool, we took them off. We did not need them in kind. I want to be clear, our cases were low. They, it wasn't like, and so when we reallocated them, they did part of the FEMA assessments in Rockton.
Okay, excellent. Thank you. All right, I'm going to try a transition here. I don't know. I'll be hopefully with you guys all the time, but I may fade out. I'll catch you in a moment.
Okay. So is there anything else we need to discuss in regards to the health department budget for 2022 before we move on to the North Court budget? Okay, can we move on to the North Court budget?
Okay. This is the schedule of rents that we're anticipating for 2022. We'll have a full year of the health department renting their space, and then 3 months of the contact tracing space up in the 3rd floor. Then we have the S&S Machine Works, the psychiatrist, and we aren't seeing anything from the veteran assistance or the veteran affairs office.
They're supposed to be paying us, Jim, so we may want to get back on that with the county.
Okay, all right, yeah, because they have.
Last year they just did a line item, didn't they just do a journal notation and transfer the funds?
Yeah, I believe so. But yeah, we haven't received any any payments from them. And then we have the dentist here. So as of the way it stands now, we would get, not including the veterans, it would be 466,000 in rents. Um, so, and as far as the expenses, I'm anticipating that, I'm kind of more concentrating on what they're going to do in 2021, because we did fund $350,000 for them for elevator repairs, which they're just starting to get bids on now. And so I'm expecting, that these would be encumbered and executed in 2021, so that they would, and essentially, for our benefit, I would concentrate maybe on this middle number as to what repairs and maintenance they do, and that they keep that up. Because if they're funded, then they should go ahead and they're needed, they should be done, so that we keep this building up. So that's just kind of that's I think the best strategy. It's not very involved, but that's as far as the physical condition of the building. That's not really my expertise, but because they have taken their time as far as this elevator situation has been,
Oh,
and so I guess that's overall that, it's not a financial concern. It's more of an operational concern and timing, as to, when these things are done. So,
Right.
because, if we, here, even with the rentals going, down, or the actual income, because there's no transfers out of the health fund, they still should run a surplus, a modest surplus. So after all their expenditures. So,
Okay.
all right.
Anybody have any questions for Jim about those? Okay. Those are the overviews, the rents, expenditures, and the summary for the budget. Are you with us, Dr. Halverson? Just wanting to know how far I should go.
All right.
Okay.
Stop share.
There we go. Okay, we reviewed the health department budget and the Northport budget. I think we've gotten some good explanations about that. We've covered that. Items 2 and 3 is the agenda. I guess number 4 would be to say, do we need an executive session?
we do not.
Okay. Any additions that have come in or need to be taken care of?
No, I know we had the late breaking on the finance committee regarding again, some of these vendors are just coming, it's hard to get a hold of them, get them back online for the monitoring devices for our ultra cold freezers. We are continuing to vaccinate away. So that becomes an important, and we're going to be having an audit of our vaccination site and our storage. She just sent it over July 14th. It's hard to believe. So we're beating the clock on that.
Okay.
So last minute response and reach out. And we do have a budget narrative. Jim and I are finalizing it. And I know, we need to put some graphics in there so that it goes with our budget to the county board. So we should have that for the next meeting.
Okay, and do we have a schedule for the next meeting when you will have that available for us?
Well, it's our routine meeting, right, Jim? Are you on July 14th?
Yeah, and I can, yeah, and I can make some minor modifications just to have everything aligned, but I don't anticipate big changes in this budget. But yeah, on our normally scheduled meeting the 14th, I guess we can handle all that.
We will have the
Okay.
narrative available.
Yes.
Yep.
And
Okay.
actually, I mean, we do have like the framework of the narrative. I mean, Jim, we could put that up now if, you know, I know, because I know our board likes to look at that. So I know we're still waiting for some of the graphics.
Okay.
Yeah, I made the changes. Do you want me to send it to you, Dr. Martell? And you,
You can just put it up on this. Yeah,
Okay.
we can, well, you just did the pages, right?
yeah, I made the changes.
Okay. Yeah, if you want to send it over,
All right.
and then I can, we might as well start there. And that way, if we want to make adjustments, we can get working
Okay.
too. Since we're,
Right.
I can't believe we're ahead of schedule at 6:07. So, you know, and I see Dr. Halverson has signed on from his
Just in time.
time. It's all good.
All right.
I thought we'd be here a couple of hours going over this.
We try not to.
Well, when we have the kind of people that we do that lay it out so well, we can
Absolutely.
do
This
it
is
very quickly.
absolutely marvelous. Sorry you missed it, John.
Well, I caught most of it through the phone. I didn't get to see all of you until the very end,
But we are getting a chance to see you, which is really good.
well, that's
The one that you got it, that you've got dated as 6/28. So
Oh, all right. You found it?
Yep.
Okay. Oh, okay, good. I was just consented. Okay.
okay. You know, and again, we never change this definition because we have to continually re-educate our public, you know, the public and our county board. So this hasn't changed. But I think that I wondered if I should highlight this or not highlight it. I think you all, 12-member Board of Health appointed by the county chairman with full consent of the board, full description. And remember, I think it was Dr. Helen and Dr. Halverson who made sure we had added this in a much more robust way. And so I don't know if it's good to end it on the emergency preparedness or response activities to public health events. I think hopefully the board has understood what that might entail, what that includes. It's not just communicable diseases, but I just came back from something on the Rockton campfire. You should all know this. Remember, this is education really to not only, it really goes out with the budget book about what our strategic plan is. And the newest thing is that was 2025 when we committed to all of that. And this was kind of a little bit, we started this last year as this kind of alignment of strategic plan with our COVID-19 pandemic response. And so it's changed a little bit because probably the most important thing is looking at now is the review of vaccination rates, right? I mean, we're adding the new vaccinations. And a couple of routine reports. We are starting to, at ongoing basis. Again, the advocating for the policies. And again, I can send that out. If I'm going too fast, let me know, because I probably have looked at this so many times I can't, you know. So I think it's important that they understand those three core functions: assurance, policy, and assessment. So the first slide was really addressing that assessment. This is for the policies. And I think a lot has gone on to really address how we responded to the executive orders, the policies around social mitigations. Think about the things you adopted, regarding our employment. I continued to participate in the policy group regarding pandemic response and how to engage local elected officials in their responses. And one of the things that this year has been is part of the recommendations coming out right now. I participate on the school committee to help develop the guidance, and there's several health departments that are represented, and ourselves and a couple of other as we develop the guidance on returning with ISB and IDPH to return. What are the policies that the schools are going to be following in the fall? So that's been a big kind of a lot of time being spent now. So not so much on counting cases, but more developing what is it going to look like in the fall to return students to in-person? What is it going to look like? What kinds of activities are going around? Are we going to change our policies and procedures on isolation and quarantine and testing in that population? And then the implementation of the plans. I think ongoing revision and implementation of the population vaccination plan. So talking a little bit about our transition from the mass vaccination site at Sandy Hollow to more community-based vaccination site. So we've got the RMT Vax Up for community 815 for community events. I used to panic when I saw that food truck and how crowded it was during the pandemic, but now I'm very proud at the very end anchoring it is our COVID-19 Vax Up bus. So we're continuing our efforts on that. I think you've probably been seeing, if you got an idea, and we haven't probably put out a report on all the places we've been, but we're continuing our partnerships. Businesses now are asking us to come with the bus. We've got places like Comfort Keepers. Most recently, we just finished a big event. Every couple of weeks, we're doing the homebound vaccination outreach and efforts. So they get one-on-one service. We've had to obviously continue development and implementation of incident action plans. And we've really had to kind of start to develop and implement the demobilization and recovery plan. What does it look like to return to our routine health department operations? And what did we learn from this experience that we're going to have to carry forward, right? I mean, we're still in response, but we're beginning to bring people back, and people are, we're figuring out in our departments, what does that look like to bring them back, whether it's remote work, and how would we handle it for future? WIC, it gave an opportunity for our WIC program to do things like, they went from paper coupon printing to electronic benefit transfer. In fact, they were excited. They went out to a community baby shower with their laptops ready to roll, to enroll people in the program. So it gave us some opportunity to focus on some things that develop on our other programming. Engage with community partners. I mean, I think that one of the efforts we'll be talking about a little bit as we move forward is the constant participation of our Medical Reserve Corps. We could not have pulled off these responses earlier, especially from the contact tracing until they had grant funds, and we hired people in. It was volunteers that worked with us from the colleges, the university, retired individuals that, stepped up, helped answer phones, helped to do that. A little bit of that coordination of public health response. Remember, I'm kind of emphasizing this as part of one of our functions. And really the transition of the Joint Information Center for Management of Information to Winnebago County Health Department. So that's pretty much fully validated now, with us being the lead on all kind of COVID related responses. And again, review and develop guidance. We talked a little bit about that. So we're really that system development. And this gave a little bit of structure so people understood what roles people were in, what that required. So we can orient. So, I think you probably would all figure out I'm the incident commander. Katie O'Toole is our deputy incident commander and our liaison officer. So she sends out a report every Friday to all of our electeds and first responders. Hey, what's going on about COVID? Gives them some detailed reports. Legal policy, Lafa Vaughn became our attorney this year. A communication, including hotline and email, was Cynthia. She was our strategic person. And Ryan Kirch and Jennifer Schnapp were on our safety committee. So they were the ones looking about our internal safety policies related access to building, things like that. Rebecca Lyons, who joined us mid-pandemic, is the planning section chief. And on surveillance was Abby Kittler and Peter LePayton, kind of leading up a lot of the report section. Operations section chief was Todd Kisner, and so you see he's got his team now developed. We've got long-term care congregate setting strike team was Jennifer Demlow. Communities of concern is Cheryl Floyd, and then contact tracing were his two supervisors, Michael Jarvis and Lisa Stravinskas. And under logistics is Todd Marshall. He makes sure that we have all the supplies we need and make sure that we're all running smoothly to where we need to be. And so he's been kind of the lead. He also works with the staffing section. And then, of course, we make sure Jim is always in session because he's got to make sure we're paying all our bills and getting paid. Most important, right?
Yes.
Oh, you bet.
So I think we kind of advance a culture of quality. If you go back to maintain and ensure workforce development. There was a lot of, training that went on for case investigation and contact tracing. They rolled out new software on all of this. And I don't think people can appreciate that the COVID-19 hotline is continually working on making sure that responses to people's emails, concerns, questions are consistent and validated, right? So if someone says, I've got an AstraZeneca in Europe and I want to get a second dose, that all has to be vetted. Like we have to cite the resource, a reference for that. So that's extremely important. And again, we've cut it down from daily press briefings to routine based on what's going on. We still are doing the daily report on the metrics, although we are not doing, large printouts on that. And a lot of media is still interested about masking, things like that. Community outreach by communities of concern, they've been doing a lot of work to try and get this next wave of vaccination in. And again, we've continued with our hotline and email responses, and it was a good thing. I mean, a lot of places shut their down. We transitioned right away into ChemTool as well then. So we were able to keep those lines up and running really as a response. This is, I'm going to call it, I'm going to spoiler alert for all of you who want to know the next thing that's going on is Peter will probably be giving, we've got a session scheduled with all of you to do some prioritization. Angie survived it with us on the county board. And Angie, I should show you the results you'd be very surprised about things. But essentially, we had started that community health collaborative before the pandemic to do the assessment for our RA plan. And so of our strategic issues, we started out with maternal and child health, mental behavioral health, violence. This time, the strategic issues came out as disinvested in vulnerable neighborhoods, maternity and early childhood care, mental health system capacity, violence, crime, and public safety, specific morbidities, education, employment, health literacy, and trust. And so how did that look at our 2020 from our own health department was maternal and child health, violence, and mental health. So we clearly had those three going for us. And we had under that and strategies to ensure health equity. So we're going to be working you through an exercise to kind of do some alignment of the remaining and figure out how we can work those and weave those in. So that we're still working on that. So you saw those from before. Okay, those were just examples. And then, oh, Jim, you've already got it updated. Okay. So I should go back one. There we go. So we had FY21 excluding COVID relief, you can see 62.2% were coming out of our, grants. And this makes us very vulnerable, as we know, like when we have an administration that doesn't pass a budget where grant funding comes in, right? Remember those years. So when people say 24.8%, so just about under 25% are coming off the levy. And then fees and permits were about 12%. Medicare, Medicaid is third party now. And again, this is a strange year, right? Because we know that we were not doing a lot of billing and we really are a safety net. So typically we're seeing clients that are not eligible for that service, right? We're trying to get those people into their medical home if they have Medicare, Medicaid, or another third party. So then Jim, this is with it, including COVID relief, I would think.
I think I'm not seeing the slides. I'm sorry. I just
Yeah, we're not seeing the slides, Sandra.
Oh, that's weird.
All right.
Are you seeing
there
it
you
now?
go.
There we go.
Yeah, there we go.
Thank you.
No, that's weird. Okay. All right. Don't know what I did there, but I'll have to come back. So I know, Jim, you're showing this excluding COVID relief. So
Right.
it doesn't change.
And that's including, yeah.
Relabel that so it's clear.
Okay.
But you can see then a bigger chunk came in this fiscal year that was grant, and that was to support the COVID. And then we're going to stabilize a little bit in fiscal year 2022 with the grant funding kind of coming down because the COVID monies are coming out. Anything else I should say about that, Jim?
No, I think we've captured it there. Yeah.
All right.
You said blue is levy funding, correct?
Blue is levy.
Yep.
And I always, the one that, always I come back to, I know county board members always freak out about fees and, like, let's not fee everyone to death. Really, even on, when you start looking at it with all the grant funding, we're under 12% are really fees associated with, and those are primarily from the permit fees to recoup the cost of environmental health inspections and things like wells and soil borings. I'm sorry, this color is mine's showing a little weird. Okay. And this is just another way to look at where all the fees are coming from and the kind of the trend line. So grants, if you look, it's fairly stable, except for 2021, which we would be able to explain is from the COVID contact tracing and the COVID relief funds that came in for the vaccination plans. So Jim, levy funding is $9.10 per person now.
Right. It took the population of 284,000.
So the population based on our current census estimate dropped a little bit. So the amount on the levy bumps it up, but we're still really under $10 per person. And again, I really we'll probably take a look and see if there's some more updated information, but as we knew, I can't even tell you what it takes to contact trace now, like the outbreak that's going on associated with the camps in central Illinois. And again, when you start talking about even our current, and did you update this one, Jim, yet?
As far as the influenza, no, I didn't. But
we'll make sure we highlight that. I don't know if it's changed. And I probably didn't tell you to change that or look at it, but we'll put that on there. But I think it's important because people have a hard time understanding, like, I think people think you get rich on, levy. It's less than $10 a person. Again, concerns in revenue, we have that maintaining competitive fees. I've been working with the current chairman about, can we build in some of the ordinances with a cost of some kind of a cost adjustment that doesn't require full board approval on a consistent basis, whether it can only adjust based on the CPI or something like that, because it's really difficult to keep going back because, no one likes to know about fees increasing, right? But the cost of delivering services is continually increasing, and we're going to have to kind of keep an eye on it, especially as inflation and some of those other predictors as the economy comes out. We have the ongoing fiscal impact of COVID-19 on the economy. If we have more facilities close, right? If we have more people move out, that's not a good thing. We talk about the loss of fees. Okay, let me correct that right on the fly. Fee-based revenue, due to the pandemic. Increase in proportion of funding from grant revenues. Again, it's year to year, but we really have to kind of be thoughtful if we get into a situation where an administration changes or they fail to pass a budget like they did in previous years. We know how hard it was to sustain ourselves during that time frame when we're so reliant on grant funds. And again, we talk about this every time. We have to say level levy funding. No one's increasing taxes, as we know. And I think we have to keep coming back to, we don't get any direct funding for any of our health priorities. We go back, we look for grants. One of the other areas I'm kind of, even as I've said, now I'm going to kind of swing the sword the other way on the grants, is I really feel one of the areas that we don't have is a good, we go after grants that are offered to us, but I really would like to be able to go after grants and find them that would apply, that would help us move some of this through. And we just haven't gotten ourselves structurally there yet. But to pursue competitive funding and grants, and I'm not talking just about a community foundation, I'm talking about some of these larger ones that it would be nice to go and see if we couldn't get some of these. We went after the adolescent pregnancy with the state, but that didn't really help us in the end. But I think that we're going to have to continue to go after them. Trauma informed, you think about, we didn't really, with the COVID response, we did not get after some of the dollars that we could have out of the community mental health. I would like to have been able to write a grant against that. But again, being in response, because those were dollars that went out into the community.
Is that what we would need a specific grant writer?
Well, that's what I'm
Whether-
looking at to see how other health departments are managing some of this. Larger ones do, but if it's, kind of training up, or figuring out how we do that from our multiple positions, but it's something I am looking at, so that we can get some different kinds of funds, not just the typical and usual that we compete at the state level for. I think we have to really, again, it's something that looking at some of our programs. Now this year they were pretty lenient on fulfilling grant deliverables due to a prolonged COVID response. But after December 31st, if there were large outbreaks and we have to redivert our staff that normally work on grants to support COVID, this could be a tipping point.
Sandra,
Yeah.
We have brought into the chairman's office a grant writer, that she's doing most of it under safety in the sheriff's department. Maybe if you talk to the chairman, since Rockford's also involved in that, if there isn't, and check with her to see if she has extra time, and we could actually probably pay her if she can get us some grants too, if she has time to do that. Because that would be something that we already have someone in place that perhaps we might utilize.
Is that Marlena Dockin?
Yeah.
Okay. Yeah. I'll check with the chairman on that. And I think probably we need to take this out. We no longer have as many concerns, but again, these are always structural issues on we think about, we now have a current administration that is much more in favor of things like Title X, refugee, vaccines for children, but it's always a fluctuating target, right? Depending on which administration is in and the support of the Congress to allocate those funds. And I think that one of the things at the Northern Illinois Public Health Consortium level, we continue to remind the state, you have underfunded us for years now. And so when these kinds of activities hit, we are not able to, gear up fast enough or furious enough. I mean, if we had not had the contact tracers on, our ability to respond to the Rockton campfire would have been impacted. So it's really important that they start to look at what is it cost to fund public health in the state from state certifieds, because they do not function, they do not provide service. So we're the ones providing services on their behalf. Expenses we don't supply, increasing contractual costs for services and supplies, and we'll have to see how the inflation rate hits on that. But we know during COVID, some of them just jacked up the prices beyond normal. Again, implementation of plans, our public health emergencies, this doesn't surprise us, communicable disease, emerging. We still haven't really seen the impact of recreational marijuana, and we're still addressing the waste management concerns, right? We still have the landfill that we haven't fully, and now we'll be dealing with the chem tool. This is, while the immediate fire has been, suppressed, the environmental and the public health, I'm going to say the health impact response will continue for monitoring for quite a while. And it's almost, kind of sad. I got a call from Grundy County asking for support as well as they address their Morse, their lithium battery factory fire. Environmental health. I mean, Todd and I talked about this, the aging infrastructure, lead, blighted properties, wells, and septics. I mean, it'll be interesting to see what we learn about things like the Miami building collapse, and the infrastructure. What that talks about. I mean, we've got water systems and things that, we have to really be watching about. And of course, I think we put this on there in years past as bioterrorism event. I'm hoping we never have to address that. And of course, natural disasters. I look at what's going on the West Coast right now with their extreme heat and responding to that from, a prevention, keeping people safe. And at the same time, we're in a time frame where they are dealing with potential wildfire season and other kinds of, in addition to COVID, just because, they got that for fun. And Jim and I, we put this on a standard. I put this on every year, Jen doesn't even get to ask me about it. I just say anticipated increase in health insurance costs. I think we have to think about that. The county has been very successful at holding the line, but it's always a challenge and a concern. We don't know what the impact of COVID will have had on that system. We know that people do not seek routine health care and people are being diagnosed a little bit later based on some preliminary data coming out. Salaries of experienced replacement staff. We know the new workforce has gotten out there and they are at a premium. And so understanding that when people leave or when we hire new hire on, we have to pay competitive wage if we're going to really recruit and retain these individuals. And again, information technology, I feel like that's an infrastructure that we just have to kind of deal with. And I think rather than a consumable office product is to remember it's not just the devices on the desks, it's all the wiring, it's all the cabling, it's the network size. It's when you're doing all kind of cloud-based system. We just had a new time clock system put in and it inactivated all of our badges. So we are in COVID. So now we got to figure out how to get new badges made. And I was laughing, monitoring of vaccine refrigerators and freezers. It is now all web cloud-based. I can look on my phone, my watch, and see what temperature freezer one is at. And then again, I think one of the things that we talked a little bit about the chem tool, we're launching the health survey today. The health impact is being launched on our Qualtrics platform. So we have leveraged that investment to really support another activity under emergency preparedness. That, to be honest, if we had not learned our activities through COVID, we would not have had access to that. And again, we're going to be registering, it sounds for a while. Population vaccination campaign for COVID. I mean, I can't, we're going to continue on this effort. It's the cost of delivering a vaccine now, I can't tell you what it was, but I know, think about, we were able to do a couple thousand a day at Sandy Hollow. We're now doing 20, 30, 40. If you think about sending everyone to a home visit to vaccinate and then having someone remain to monitor the person for 15 minutes, the cost is obviously increasing. Potential inflation costs. Again, management of 555 North Court, we are the tenant base that we have to maintain. And so again, that's dependent on, so we are our own tenants. So I should put into decreasing external tenant base of support. Maybe that might more, that's the good news about doing this on the fly like this. A capital plan, when I'm saying for aging mechanics structure windows. This year, I think you all know we had to replace the blower motor on the top of the building. And they decided, this went out during this, they were able to get the part. We had to have a crane and a boom lift install it with our facilities. But now they want to move it. That kind of system is no longer, what is it called? It's not current technology, and it's also not like sustainable, because now they want them on the outside on the ground level, because these things get heavy and that's why they tend to burn out more. So I'm learning more about that kind of stuff too, who knew? And then some of our windows need replacement in seals. When the building was first purchased and, on behalf of it. So again, we got to invest in it.
Did we not have a program where we were replacing so many windows per year?
We put it in the capital, wasn't it, Jim? I mean, at some point I know Pat had started it. I think we had to use that for the bulletproof glass that year that they shot out the windows on the front.
Yeah.
It wasn't targeted, or it wasn't targeted at us. They were just driving through the parking lot.
Right.
So again, strategies to address concern, we've kind of talked, and I'm glad to see it. I'm sorry, Jim, I had missed the top header on yours, was again, looking at that mid-year COLA like we normally do. And that's because we have an opportunity to take a look at what it looks like after 6 months on their grants. We're going to continue to look at our work hours. We adapted the remote work policy. Center directors have indicated that they've gotten some more productivity out. And that's not always, not at the cost of quality, and while giving employees more control over their work lives, right, and their time. We continue to work on a regular basis with purchasing so that we're able to get the best prices on things. We continue to look at review. We got a little bit behind this year, and we'll continue to look at it. And that's why I'm really working with this chairman to build some language into ordinances related to, so we should be doing a fee structure review at least every year to see if something has changed significantly. Most times it goes up, but if it went down, we'd want to do the same, right? In a year, they'd be able to do that so that we're not constantly having to go back to a board for an ordinance change or an amendment change. And again, focus on identification and new sustainable funding sources.
Sandra, may I ask you a question?
Yeah.
They're talking about another virus coming down the pipe. Are we covered for that, or will we also have to go back and look for more monies if that does become a pandemic too?
It depends on which virus we're talking about. If we're talking the variants of COVID, then I think what you'll see is an extension on the COVID relief funds. Angie, yeah, I think that, and the experts tell us that this was not the big one. And unfortunately, it felt like a big one, but, and I think that we learned a lot from this, but they typically are saying that there will probably be more emerging viruses. I just want to remind everyone that you have disposition of the Division Street facility, and that we have to kind of take a look at where it's going. We're going to continue to apply. Jim, are you okay?
Me?
Jim Powers.
Powers? I think he's adjusting his camera.
Okay. Application for the AmeriCorps, that's a way to bring some staff in and then we can take a look. In fact, we hired one of them after their stint with us because they were a good employee. And so you typically just kind of a little bit of a less investment, but it gives us an opportunity to kind of develop a person. Continue to review an alignment of resources with our strategic planning goals, expand educational and internship opportunities where we can. I know this is, do I move in? I got to take that out. We got that twice. You can never have enough cash here. Or did you? I'm going to put this out of here. It's down here. All right. I think this is a duplicate slide somehow. Yeah. All right. I'll take out duplicates. So the other part that I think, Angie, was an important thing, which we had and we used with your support at the Board of Health, is to maintain that public health emergency reserve. And Jim, is this one updated as well?
Yes, it is.
Okay. And even during this time where we earned it appropriately, we rebuilt our reserve. So remember, you allocated almost $500,000 out to start. For the Qualtrics system, we were able to build that back in.
Okay.
So again, with the idea being that while we get $10 per person on levy, we're trying to get closer to, maybe $30 per person or 3 times that amount for an emergency response. So for instance, we've had to use a little bit of that emergency reserve, like for well water testing out near the mobile home park near Sandy Hollow. We don't know what the chem tool might come in at and what we might have to support as an interim step. Not all of this is, while we will submit to FEMA those charges that are eligible, we may not meet the total cost threshold. So that's always the tipping point, right? It's kind of like the insurance deductible, right? I got to have, X amount of expenses, but if I never hit the deductible level, I got to just pay it. So that's kind of a summary. Personnel modification. We changed this one, I think.
Yeah, this one I didn't change.
Oh yeah, okay. Remember last year we put in the director of Center for Public Health Policy, so we filled it. So that's Charlotte LeClaire will be starting with us the first week in August. So she's got her start date to go. Yeah, we'll fix this up. So this is where the new positions, Jim, we can put the
Yeah.
date. Oh, you've already got this one here then. Okay.
Yep.
So And again, we probably should put a notation because you know what'll happen in a few years, county board members will not understand, Angie, and I know they always will say, well, what happened to those other 50 people?
Yeah, I know.
To the COVID response. So I want to make sure we put that in there because, you know, they'll think I either laid them off without their knowledge or, you know. I know.
Well, the second line from the bottom says temp full-time there, and there's 51, so we won't.
I know, but they're always trying to find some excuse to complain about something or catch you on something.
Okay.
Yeah, and you know, and remember, it's not. It's just that when they do the math, you're right, Jim. It comes back, but they'll be like, "Oh my gosh, you know, how did that happen?" But see, they'll be like, "What happened to the other?" So you know, you have to we just need to put a notation on it, even if it's just a start.
Yeah, for 21, we went down. Go back. We went down from 160 to 113.
Mm-hmm.
Those were full-time employees?
Those are full-time equivalents. Full-time was main stable at 106. What changed, to Jim's point, is this here, and probably what I can't get in there, Jim. Oops.
Yeah, in 2021, we had 51 for the whole year. In 2022, those 29 will only be there for a quarter of the year, so it's like 7 bodies.
Yeah, so you'll have to go in and edit that with at least a little notation because I can't get into that table graph.
Okay.
Yeah, I know you probably inserted. And then again, this is our org chart so that they can see, you know, we've got our policy and legal, strategic, quality and data finance. Our centers have remained the same. So we've not added any administrative bodies. The only bodies we've added really for this fiscal year will be the additional contact tracer and then not contact, disease investigator. And then Jim's got some other ones from grant funded. So this will be our, you know, our typically let them know who the leadership team is. And that's it. You've seen all that before. You know what our end slide looks like. You know what our phone number is. You know how to get a hold of us.
Hey.
Anything you think we should emphasize more or you want to see that you think will help? And we'll send that out as well.
To begin with, you're very thorough in everything you do. And I know they don't understand and we'll never make them understand. But the thing is, you are very thorough. And you know, and you have everything to back you up. It's good. If I can understand it, the rest of us should be able to understand it. Because I'm just that way. But I think you've done a fantastic job with this budget.
Jim's done a great. I mean, he's really kept us going. You know, I mean, to really keep us whole during all of this.
In fact, to be honest with you, I keep telling the chairman they ought to really look at how you do a budget and do your reserve and everything else because we still, as a board, haven't figured that out yet. And the county health department is always right on schedule. And for over the years, all of you who have been here all those years have maintained a well-balanced budget forever. And they need to take a lesson on how you do it. And I've told them that many times.
Well, thanks, Angie. Our goal is to, you know, again, we've got to be good stewards of the money. I've got a good board that works with us. I have to say, even during the summer months, we have to pull you together for an extra board meeting to get through the finance. I appreciate that because it makes it, you know, we can make the edits as we need to. We can do explanation. We can make it better so that we can get it through and we're on time for delivery on it.
Yeah, isn't that amazing?
Okay, that was preview of coming attractions, right?
Coming attraction. We'll send it out. I'll have Christina send it out so you can look at it and send us any edits that, you know, you'd like to make so that we're having it ready for the next meeting.
Thank you.
Okay.
Now, Jim, yeah, now we see you. Now we were like, where did he go?
I've been here over. Oh, him. Okay.
Oh, I keep calling the wrong Jim Powers. Sorry about that.
We have Jim 1 and Jim 2.
Yeah.
depending on-
I should go Mr. Powers and Mr. Keeler. That way we've got it all together. Mr. Powers and Mr. Kurt Keeler. And so appreciate it all. Stay safe. Any questions you have for us? You want to?
Okay.
Great job, Margaret. And Margaret, my goodness. Sandra, sorry about that.
You can't respond to anything. It's like the gyms 1 and 2.
Yeah, I know it.
Would you like a motion for adjournment, John?
Yes, please.
I would move that we adjourn the meeting.
So move.
Second.
Yes, second.
Okay, all in favor, signify by saying aye.
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 Meeting is adjourned. Thank you all very much.
All right. Stay
Okay.
safe. Agree.
Thank you,
Good night,
Jim.
everyone.
Good night.
Night.
Thank you.